Our topic is on hCG, and the test is hCG Pregnancy Rapid Test Strips MonlabTest, a rapid test for qualitative detection of human chorionic gonadotropin in plasma, serum, and urine.
The analyte detected in this test is the human chorionic gonadotropin or the hCG. It is a polypeptide hormone produced by the human placenta. This hormone stimulates the corpus luteum to produce progesterone, which can help prepare the lining of the uterus for implantation. So the human chorionic gonadotropin is an important hormone in the detection of pregnancy. The hCG Pregnancy Rapid Test Strip lab test is a rapid chromatographic immunoassay for the qualitative detection of human chorionic gonadotropin in the urine, serum, or plasma to aid in the early detection of pregnancy. This test can be used to see if a woman is pregnant. This hormone can also treat fertility problems.
Principles of the test. The hCG Pregnancy Rapid Test Strip by MonlabTest is a rapid chromatographic immunoassay for the qualitative detection of human chorionic gonadotropin in urine or serum or in plasma to aid in the early detection of pregnancy. The test uses two lines to indicate results. The test uses a combination of antibodies, including a monoclonal hCG antibody, to selectively detect elevated levels of hCG. The control lines is composed of goat polyclonal antibodies and colloidal gold particles. The assay is conducted by immersing the strip in a urine or serum or plasma specimen and observing the formation of colored lines. The specimen migrates via capillary action along the membrane to react with the colored conjugate. Positive specimens react with the specific antibody hCG colored conjugate to form a colored line at the test line region of the membrane. Absence of this colored line suggests a negative result. To serve as a procedural control, a colored line will always appear in the control line region, indicating that proper volume of specimen has been added and membrane wicking has occurred. As you can see aton example picture, may kita two strips, a pregnant and non-pregnant. Has step A, we can see that may the hCG present ha other strip specimen nga gindip and test strip. An other, waray kay di naman burod pero makita mo naman. Now, has step B, we can see nga nag-bind ang hCG ha nakag-attach na nga antibody nga may ada colored circle. Ito nga colored circle are anti-hCG monoclonal antibody with enzymes. The hCG binds to place monoclonal anti-hCG bodies with enzymes that trigger a color change. Yan makikita natin itong ubos nga color change nga duwa nga strip positive patient, positive pregnant woman. And then after mag-bind ang hCG nga nanin first nga antibodies with enzyme, ma-bind again hira ha already placed na anti-hCG monoclonal antibodies bind to already binded hCG that triggers color change. So, ang second nga antibodies is a normal monoclonal anti-hCG antibody. Then, the last step is already placed monoclonal antibodies compatible to the anti-hCG antibodies bind to anti-hCG and triggers a second color change. This is the control test that will cause a color change not mattering the presence of the hormone. So, kuha na lang nila ano ba ito? Bagad dead man na lang niraan presence with hormone. Then, after hito, makakita na kitahin duwa nga strips for positive pregnant woman. Diri positive for COVID.
Procedure of the test. First, bring the pouch or canister to room temperature before opening it. Remove the test strip from the sealed pouch or closed canister and use it within 1 hour. Second, with arrow pointing towards the urine or serum or plasma specimen, immerse the test strip vertically in the urine or serum or plasma specimen for at least 15 seconds. Do not pass the maximum line on the strip test when immersing the strip. See the illustration below. Third, place the test strip on a non-absorbent flat surface. Start the timer and wait for the colored line to appear. Read the result at 3 minutes when testing the urine specimen or at 5 minutes when testing a serum or plasma specimen. Note, a low hCG concentration may result in a weak line appearing in the line region. After an extended period, do not interpret the result after 10 minutes.
For the result, there are positive and negative result. For positive result, there are two distinct color line appear, and for negative, there are one color line appear in a control region. It means if there are two lines appear, your hCG level are greater than 5 MIU per ml, which is could also mean that you are a pregnant woman. If you are negative and you have less than 5 MIU level per ml of hCG, it means you are negative. But if the in the strip test, if the line occur in the result line and no line occur in the control line, it means it's invalid. A suggestion, you have to take the test again. If there's no line appear both in control and result line, the result is invalid. You should take another test.
Here we have the unique notes. We have the sample requirements, sensitivity, and specificity. Sample requirements, we have the materials provided, the test cassettes, which contains mouse anti-beta hEG, disposable pipettes, instructional insert materials, and the specimen collection container. For the specimen collection preparation, a urine specimen must be collected in a clean and dry container and transferred using a disposable pipette, and the first morning urine specimen is preferred. With the blood should be collected into a clean tube without anticoagulants. Separate the serum from the blood as soon as possible to avoid hemolysis. Sensitivity and specificity. The cassette detects hCG at a concentration of 20 MIU per ml or greater in urine and 10 MIU per ml or greater in serum. The test has been standardized to the World Health Organization. Serum testing is much more sensitive and specific than urine testing, measuring the exact amount of hCG in your blood. Urine testing, however, is more convenient, affordable, comfortable for patients, and has a fast turnaround of 5 to 10 minutes and does not require a medical prescription.